Pleasant morning to all of you. This month we are observing World Macular Degeneration Awareness Month. So a few things about macular degeneration. It is a degenerative eye disease that affects the central part of the eye known as the macula. In this, the patient's central vision is affected, whereas the peripheral vision is fine. And most often, as we know, this affects either one or both the eyes, may not be at the same level of intensity. And the risk factors for these macular degenerations are, especially as the name suggests, it's age-related macular degeneration. So the people above the age of 50, especially overweight, smoking, people with hypertension, especially people with high saturated fat in their diet, these are the people who are at risk for developing age-related macular degeneration. There are two types in this, known as dry macular degeneration as well as wet macular degeneration. Dry or atrophic macular degeneration, in this there are tiny protein deposits in the central part of the eye in the macula known as drusen. Patients with it's a very slow progressing, so they will have loss of vision in the center part of the eye very slowly. Sometimes they're not even aware of it, they're asymptomatic. This can 90% of the people can have dry macular degeneration, and they can proceed to have wet macular degeneration later on in their life. The next level is exudative macular degeneration. Here there is some amount of abnormal blood vessels developing underneath the retina. Because of there is fluid retention in the eye, and this progresses rapidly where they lose the center part of the eye completely. They can even go blind. There are three stages in dry macular degeneration. Early, where the patient is symptomless, patient is not aware that they have macular degeneration. It's only detected on clinical examination. Comes the intermediate, where patient will have slight blurring of vision. Sometimes lines are straight lines are wavy. The next is the advanced stage, where the patient can have complete loss of central vision. In case of wet macular degeneration, it's already in an advanced stage where the central vision is already in a complete loss of vision. When should you visit a doctor to diagnose yourself with macular degeneration? Routine eye examination will help us detect whether, when we dilate, a dilated fundus examination will help us determine whether your retina is good or not, and if so, if there are any changes in the center part of the eye, we will be able to detect with regards to macular degeneration. We'll be doing certain tests like OCT of your macula, fundus photo will help us also, along with a clinical examination, to diagnose you with macular degeneration. How can we prevent macular degeneration? We always have to maintain a well-balanced diet rich with micro and macronutrients, lead a very physically active life, good amount of exercise. If you're a smoker, please quit smoking or reduce it, and also reduce blood pressure, and your cholesterol levels have to be in check. All this help us to maintain the very good eye health condition also. Since many people are not aware of macular degeneration also being one of the diseases of the eye, because we are aware of diabetic retinopathy, glaucoma, cataract with regard to different eye diseases. But with regard to macular degeneration, people are not aware. So I would suggest, please get especially people above the age of 50, please get your eyes checked, do a dilated fundus examination, ask your eye doctor or ophthalmologist to examine your eye, and if it's all good, well and fine. If not, we'd have to do further tests to determine if there is any underlying health condition. Especially younger people, please get your relatives, your parents to come to the hospital to get a detailed eye examination done, not just for glasses, but in an eye hospital. Thank you.